What are the causes of this breast cancer? Why it was in India, the breast cancer was not that common earlier, and today it is much more common. It has surpassed the cervix cancer, and today it is one of the most common cancer in the females in India and globally. Normally, the difference, if you see in different countries, in US nearly 6 people are diagnosed with breast cancer, out of that 1 female dies. Whereas in China, 4 females are diagnosed with breast cancer and 1 dies. But in India, 2 are diagnosed and 1 dies. The main reason is the lack of awareness, screening them on time and treating them. So this type of awareness lead to early diagnosis, screening and all that. The main causes, what causes breast cancer? If you see, the lifestyle previously and now has changed a lot. People, the females are highly educated and the marriages are delayed. The childbirth is delayed because of the working atmosphere. They are not able to breastfeed their children. And the OCPs, oral contraceptive pills, are being used. Yes, they are to be used, but not in continuous for more than 5 years. And that can lead to breast cancer. Hormone replacement therapy, what we give after menopause, early menarche, late menopause. This is also one of the causes. The main culprit is the estrogen and progesterone hormone, which every female has. Other than that, if you see, alcohol is also one of the contributory factor. Tobacco is one of the contributory factor. Yes, obesity. Now, the hereditary. If a mother has breast cancer, will all the children develop breast cancer? How common? Yes, it's just 5 to 10%. The main reason for that is the BRCA1 and the BRCA2. Those in family where mother and sisters have, those children should undergo BRCA1, BRCA2 testing. Like Angela Jolie, she knocked both the breasts out because she was strongly BRCA1 and BRCA2 positive and she was able to save her life. Like this way, but not to panic. Hereditary is very, very rare. It's less than 5%. Those females who have a family history should be extra cautious, and what they need to do we'll discuss in the later slides. Now, quickly, how will a patient or a person, a common man know, a female know that she may develop a breast cancer? Like, for example, a lump which was not there suddenly appears. Patient should be cautious. Or the nipple which normally discharges milk, discharges some serous fluid or discharges blood in that. Similarly, if there is a change, increase in the size of the breast, or the nipple goes in, or the nipple is inverted, or there is a different lump in the axilla, or the breast becomes like a pedo orange, like an orange. Any such symptoms or any such lumps, such females should be extra cautious. They see, normally 80% of the breast lumps are not malignant, but few of them can change into malignancy. So any lump should be taken into consideration of a risk, a minimal risk of it becoming malignant. Now, screening is saving. Screening is nothing but like a servicing. What you normally do is, there are 3 different ways. One is a simple breast self-examination which every female can do at home. Just examine the breast once in a month. Now, the breast changes the whole month. During the menstruation, the breast sometimes becomes nodular, sometimes firm, sometimes hard. So there should be a specific time. The time suggested for breast self-examination is 1 week after menstruation. And what about those who are menopause or those who are after the menopause? They need to do on a fixed date once in a month. Clinical breast examination. That means a physician or a clinician, a female gynecologist, or anyone can have a look at the breast. When should it be done? Once in 3 years. When it should start? It should start at the age of 25, breast clinical examination. Now coming to a mammography, a test, an X-ray, which does wonders. How? It can detect a malignancy 3 years in advance. Less than a centimeter lump, which is not palpable, can be seen during the mammography, and you'll be able to diagnose it. Now, how should it be done, the screening? The screening should be at least once in a year after the age of 40. What is alarming nowadays is the breast cancer is not the disease of old age. I often see in my clinic patient walking at the age of 20, 25, 30, 40. That means the young are being attacked. So the young and middle-aged people are more common now as compared to elderly. So what about their screening? We should start the mammography screening at the age of 40. It should be once in a year. Maybe after the age of 50, it should be once in 2 years. What about those who have? Now how do you examine the breast? That was there in a different positions.